Today I'll introduce you to a radiation oncologist, Dr. Cupino. Tell us what it is that a radiation oncologist does.
Sure. So as an oncologist, that means I take care of mostly cancer patients. And as a radiation oncologist, that means that the modality of choice that I use is radiation therapy. The most common way of delivering radiation here is high energy X-rays. Sometimes we use high energy electrons, and then sometimes we take radioactive pieces of metal. We can implant them in people. In the general treatment of cancer, you usually have 3 doctors involved, a surgeon, a medical oncologist, and a radiation oncologist. The beauty of radiation is that its side effects are all localized because the treatment is localized. The downside is, since the treatment is localized, it doesn't help patients who have cancer in a lot of places. It only helps the cancer in the spot I can aim at. It used to be that the way we treated cancer was you went to your surgeon, and the surgeon said, "Oh, you've got cancer. Let's cut it out." And then if the cancer came back, you went to your medical oncologist and he said, "You got cancer, and we cut it out? Well, let's give you some chemotherapy." And then when the tumor eventually grew, they said, "Well, I don't know, maybe we'll just send you to the radiation oncologist." And then we gave them radiation. This wasn't a very efficient practice, nor was it very efficacious. So what we do now is we have a combination of the 3 that we use for most of our solid tumors. So the most common cancers that you see are breast cancer, prostate cancer, lung cancer, rectal cancer. And for all of these, the standard is typically all 3 practices working together, unless you have a very early stage or a very late stage, in which case you may only need one of them.
You've been watching another edition of Meet St. Pete's.